All right, so what is achondroplasia? It's caused by a gene alteration in the FGFR3 gene. So this encodes for a protein called fibroblast growth factor receptor 3. This is important in chondrocyte differentiation and proliferation. It is autosomal dominant. Most patients who have achondroplasia are actually born to average stature parents, and there's a median of 4 individuals per 100,000 births. I've also seen some data to suggest that having an older father seems to increase the risk of having a child with achondroplasia, and there's some thought that maybe there's something with the FGFR3 that actually helps with sperm motility in older fathers. All right, so if you go back to your basic science classes, right, you have chondrocytes in your growth plates. They lay down this nice cartilage scaffolding. The cells themselves hypertrophy, which pushes everything out. They eventually kind of die off, and then you have vasculature come in. You have your osteoblasts, osteoclasts come in and then make bone. And so here in patients with achondroplasia, what's happening is that they have the FGFR3 receptor turned on, and so that's going to cause downstream suppression, and so then you're going to have inhibition of this proliferation and differentiation. So if you were to look at slides under a microscope, you're going to see much smaller zones in patients who have achondroplasia, right? And so when you look at somebody with achondroplasia, the places where you're first going to see areas of impact are places where there's endochondral bone formation, and so that's the long bones, and then also facial bones. So again, like I was just saying, right, if we took a look under a slide, you can see here what the bone of an average stature person would look like versus someone with achondroplasia. And so what patients have is disordered growth in the epiphyseal growth plate. So some other clinical features, right? So not only are they going to be shorter than average, there's also going to be disproportionate growth. So again, you're going to see that impact in the long bones more so than potentially in the spine. The average height for patients with achondroplasia is 120 to 135 centimeters. Most patients with achondroplasia have normal cognitive function and intelligence, and their lifespan is generally reported as being normal. I think one thing that comes up with patients and something that you can counsel on is that because of their stature, right, people may perceive them as being younger than they actually are, and I think especially in the school-age child or a middle school-age child, that could become very frustrating, especially if they don't have the words to kind of correct somebody, right, or maybe they don't feel right correcting an adult, and so that's a common thing that comes up with talking to patients and kind of helping them go through scenarios and give them sort of the words to say these things. And part of that I bring up is that people will maybe talk to a 10-year-old like they are a 5-year-old, and the kids can internalize that as like why is everyone talking to me like I'm a baby? I'm not a baby. And I do think that some people may look at a patient and just because of how they look think that their intellect isn't on par with their peers.